So diuretics, beta blockers means they will block the beta 1 receptor and they will decrease the heart rate and force of contraction. They will decrease the energy consumption to the heart. So these particularly two drugs are used, metoprolol and carvedilol, can improve the symptoms. Then third category of drug is not, the next category of drug is nothing but the phosphodiesterase 3 inhibitor. Phosphodiesterase 3 inhibitor. In that category you have ambrinon, then milrinone and ambrinon, milrinone, etc. etc. So ambrinon, okay, ambrinon, milrinone. These are known as a phosphodiesterase inhibitor. So you should know what is role of your phosphodiesterase. ये PDE जो phosphodiesterase enzyme होता है उसका रोल क्या है? What is the role of your phosphodiesterase inhibitor? Phosphodiesterase enzyme का रोल क्या होता है? So this phosphodiesterase enzyme is involved in the metabolism of cyclic AMP. So intracellular increase in the cyclic AMP, okay, that causes the vasodilation. This phosphodiesterase enzyme will metabolize that increase the cyclic AMP, and inhibition of this phosphodiesterase enzyme will again increase the cyclic AMP inside the cell, that will cause vasodilation. So, okay. So ambrinon, milrinone, these drugs, ambrinon and milrinone, they are selective phosphodiesterase 3 inhibitor. So phosphodiesterase is the enzyme responsible, specific enzyme in the responsible for the intracellular metabolism of cyclic AMP in the heart and blood vessels, bronchial, smooth muscle, etc. etc. Inhibition of this enzyme, okay, and it also increases the myocardial cyclic AMP and calcium influx. Okay, so inhibition of this enzyme leads to increase the concentration of myocardial cyclic AMP and calcium, and that's why again it will decrease the load on heart and it will increase the adverse reaction क्या है इनके milrinone and amrinone. Amrinone और milrinone जो रिनोन्स होते हैं they are known as a phosphodiesterase inhibitor. So phosphodiesterase जो है this enzyme phosphodiesterase, so there are different types of phosphodiesterase 1, 2, 3, 4, 5. So out of that phosphodiesterase 3 is involved in the blood vessels, bronchial smooth muscle, cardiac smooth muscle, etc. Phosphodiesterase 5 जो होता है that is involved in the regulation of blood flow into the phosphodiesterase enzyme will have different subtypes, okay, like phosphodiesterase 1, 2, 3, 4, 5, okay. So out of that phosphodiesterase 3 enzyme is involved in the this is present in the heart, blood vessels, bronchial smooth muscle, etc. etc. Phosphodiesterase 5 enzyme is found in the corpus callosum of your penile smooth muscle. Phosphodiesterase 5 inhibitors like sildenafil, then wild sildenafil citrate, and etc. etc. So all the pills, sildenafil, tadalafil, etc. they are known as phosphodiesterase 5 inhibitor and they are used in the erectile dysfunction. That is another chapter. We will see. वो जहाँ पे भी आएगा मैं आपको बोलूँगा. बस यहाँ पे इतना याद रखो कि phosphodiesterase enzyme, there are different kind of phosphodiesterase enzyme, and phosphodiesterase 3 enzyme is present in this where heart muscle, okay, blood vessels, bronchial smooth muscle, okay, and it causes the metabolism of cyclic AMP and increase the level of cyclic AMP in the these cells, bronchial smooth muscle, heart muscle or blood vessels, causes vasodilation. तो यहाँ पे इंक्रीज अमाउंट होना चाहिए आपको वेस्टराइजेशन की. तो ये फॉस्फोडाइस्टेरेस 3 क्या करेगा, उसको मेटाबोलाइज करता है इसको एएमपी को, तो ये वेस्टराइजेशन नहीं होने देगा, तो उसको इनहिबिट करो. आमरिनोन एंड मिलिरिनोन, these are the phosphodiesterase 3 inhibitor. इसके रिगार्डिंग क्वेश्चन आ चुका है. What is the mechanism of amrinone and milrinone? तो याद रखो. Now what are the adverse drug reaction of these drugs? They will cause thrombocytopenia, nausea, diarrhea, abdominal pain, liver damage, and these drugs are mostly used for maintenance therapy. They are used for the maintenance therapy of congestive cardiac failure. Another category of drug is nothing but the cardiac glycosides. That is the digoxin and digitoxin. That is the important part. You have to understand this. Okay. Their mechanism of action, side effect, adverse effect, etc. will continue. So you can see it is nothing but your cardiac cell. ये आपका क्या है, हार्ट का सेल है. इट इज हार्ट सेल में. हार्ट के सेल के ऊपर क्या क्या है, सो यू हैव डिफरेंट काइंड ऑफ ion channels on your heart. Like this one is known as a sodium potassium ATPase pump. This one is known as a sodium calcium exchange pump. This one is known as a voltage gated calcium. This one is known as calcium ATPase pump. Okay, sorry, calcium ATPase pump. Okay, so this is the different kind of channels are present on the myocytes of हार्ट के जो सेल है उसके ऊपर इनसाइड सेल पोटेंशियल क्या होता है नेगेटिव होता है आउटसाइड सेल पोटेंशियल क्या होता है पॉजिटिव होता है व्हाट हैपेंस सी so what is the function of this sodium potassium ATPase pump this sodium potassium ATPase pump will push out sodium and will ये क्या करेगा सोडियम को बाहर निकलेगा पोटेशियम को अंदर लाएगा आप बोलेंगे सर ये सोडियम कहाँ से आया बीच में सो ड्यूरिंग द फेज जीरो ऑफ योर डीपोलराइजेशन फेज जीरो में क्या होता है सोडियम अंदर जाता है ना तो वो सोडियम है सो दिस सोडियम पोटेशियम एटीपीएस पंप विल रिमूव द सोडियम फ्रॉम इनसाइड द सेल टू द आउटसाइड द सेल पोटेशियम इनसाइड द सेल now what happens in the congestive cardiac failure your muscle cell or your cardiac cell is not able to pump forcefully okay so when sodium will enter in the cell so mechanism of action of digoxin and cardiac glycoside is there that is a dose dependent blockage of sodium potassium ATPase pump इसको block करता है ठीक है digoxin so what will happen because of the inhibition of the sodium potassium ATPase pump so this sodium will not go outside the cell so it will remain inside the cell and if it remains inside the cell that means the concentration of sodium inside the cell increases okay? And this increased concentration causes negative effect on this sodium calcium exchange pump so a sodium calcium exchange pump the function of this pump is nothing but the to remove calcium outside and sodium inside but sodium is already there inside so this pump is become ineffective it will not remove calcium outside and sodium inside because sodium is already in the inside okay so that causes the increase in the calcium level in the cell तो ये कैल्शियम बाहर नहीं जा सकता क्योंकि ये पंप इनहिबिट किया है क्यों क्योंकि सोडियम की वजह से ऑलरेडी ये सोडियम अंदर है तो ये सोडियम कैल्शियम एक्सचेंज पंप जो है सोडियम को एक्सचेंज करता है कैल्शियम से अंदर लाता है और कैल्शियम को बाहर लेके जाता है लेकिन अंदर सोडियम ऑलरेडी है तो सोडियम ऑलरेडी अंदर है तो ये पंप निगेटिव हो जाता है ये it is become less effective so calcium will not go outside the cell that's why calcium concentrate or calcium concentration inside the cell increases okay now this calcium increased calcium inside the cell increases the more calcium inside the cell via this L type of calcium ion channel तो फेज जीरो में कैल्शियम इंटर आता है सोडियम के साथ में दैट कैल्शियम okay now this increased calcium inside the cell it is stored in the sarcoplasmic reticulum so it is stored in the sarcoplasmic reticulum via sarcoplasmic endothelmic reticulum calcium ATPase okay so this is the pump whatever extra calcium is there inside the cell that will be stored in the sarcoplasmic reticulum and when there is another okay so when there is another signal at that time so more calcium will be released from this known as a ryanodine receptor calcium channel so more calcium will be released intracellularly and there will be more calcium in the cell and this increased calcium will interact with the troponin C filament of your myocardial cell and that will activate the actin and myosin and that will cause a forceful contraction so what is your aim to increase the calcium level inside the cell क्योंकि कॉन्ट्रैक्शन जो है हार्ट मसल का वो कौन करता है कैल्शियम करता है कब करता है जब हार्ट के सेल के अंदर कैल्शियम का लेवल बढ़ेगा तभी वो फोर्सफुल कॉन्ट्रैक्शन होगा वो कौन बढ़ाता है ये डिगोक्सिन बढ़ता है कैसे बढ़ता है डिगोक्सिन इनहिबिट करता है इस पंप को सोडियम पोटेशियम एटीपेज पंप को इसका काम क्या है ये सोडियम को बाहर भेजना पोटेशियम को अंदर लाना और सोडियम को बाहर भेजना लेकिन डिगोक्सिन ने क्या किया इसको बंद कर दिया है तो सोडियम कहाँ पे अंदर ही रहेगा अंदर ही तो जब सोडियम अंदर है दूसरा एक पंप होता है उसका नाम है सोडियम कैल्शियम एक्सचेंज पंप उसका काम क्या है कि सोडियम को अंदर लाना कैल्शियम को बाहर भेजना लेकिन सोडियम ऑलरेडी अंदर है तो ये पंप क्या हो जाएगा इनइफेक्टिव हो जाएगा ये बंद हो जाएगा तो ये क्या नहीं कर पाएगा ये कैल्शियम जो है वो बाहर लेके नहीं जा सकता तो ये कैल्शियम क्या रहेगा अंदर ही रहेगा कैल्शियम अंदर ही जमा होना चालू हो जाता है तो जो जमा हुआ कैल्शियम है अंदर जो कैल्शियम ये वोल्टेज गेटेड कैल्शियम चैनल से जो भी अंदर आ रहा है वो कैल्शियम ये कैल्शियम क्या करता है इंक्रीज लेवल ऑफ कैल्शियम ज्यादा कैल्शियम होगा तो वो स्टोर हो जाता है किसमें सार्कोप्लाज्मिक रेटिकुलम में and more calcium is released inside the cell ये साइटोसोल होगा इस सेल का and increased calcium inside the cell will interact with this troponin C filament of your myocardium it will interact with the actin and myosin filament will come together to cause a forceful contraction और जैसे ही फोर्सफुल कॉन्ट्रैक्शन होता है तो वेंट्रिकल्स में जितना ब्लड है वो पूरा ब्लड सर्कुलेट हो जाता है. So due to forceful contraction, so ventricles are able to empty properly. So ventricles are emptied properly due to forceful contraction. This is caused by digoxin. So digoxin is an inotropic drug. It will causes the increase in the force of contraction. It will not cause increase in the heart rate. So it is a negative chronotropic and positive inotropic drug. Okay. So इसके ऊपर क्वेश्चन आ सकता है. Digoxin will do following things. Okay, in the congestive cardiac failure. So it will increase the heart rate, it will increase the force of contraction, it will increase the calcium level inside the cell. Okay, so out of that, it will not increase the heart rate, it will decrease the heart rate, it will increase the force of contraction. तो heart rate कम करता है, heart का काम करता है, कम करता है, लेकिन force of contraction ज़्यादा करता है, ताकि जितना भी ventricles में blood है वो पूरा circulate हो सके. Is a sodium potassium ATPase inhibitor, and inhibition of this causes accumulation of sodium inside the cell, and accumulation of sodium causes accumulation of calcium inside the cell, and in response to accumulated calcium more calcium is released from sarcoplasmic reticulum, and that increased calcium will interact with the myofilaments of myocardium and will cause forceful contraction. That's how digoxin will act. Digoxin or cardiac glycoside will act. So mechanism of action of cardiac glycosides. So positive inotropic effect. So they have positive inotropic means they will increase the force of contraction. Positive inotropic effect of cardiac glycosides is result because of the alteration of excitation and contraction coupling by calcium ion. Calcium entry is regulated in the cell by L type of calcium channel, sodium calcium exchanger, calcium ATPase, and indirectly by potassium activated sodium potassium ATPase pump and sodium hydrogen exchange pump. So digitalis will act as a potent positive inotropic drug by directly inhibiting the membrane bound sodium potassium ATPase pump. तो ये mechanism होगा. So it can be called as digital receptor. तो digital इसका receptor कौन है? Sodium potassium ATPase pump. So digital inhibit the sodium potassium ATPase pump. This prevent extrusion. Extrusion means this prevent the efflux. Efflux means it prevents the entry of sodium from cell to the outside cell. And that's why sodium concentration in the cell increases, and ultimately that also increases the calcium concentration inside the cell during the resting phase. Okay, and with the sodium, calcium will also go inside the cell, remains intracellularly because of the difference the function of that sodium calcium exchange pump. This accumulation of intracellular sodium exchanges with the extracellular calcium and increases the intracellular calcium level. Calcium is stored in the sarcoplasmic reticulum sac. This also permits this factor releases the and dispersal of calcium into sarcoplasm, which later activates the chain. मतलब increased level of calcium inside the cell will activate the actin myosin filament, causes the forceful contraction. That's how it will pump all the blood present in the ventricles. Now, what is the pharmacological actions of this cardiac glycosides on contractile function heart का? So it will increase the force of contraction. It will increase the force of contraction of okay. It will increase the force of contraction, which is due to which there is a complete ventricular emptying. So ventricle में जितना भी blood है उसका पूरा का पूरा blood pump हो जाएगा क्योंकि forceful contraction हो रहा है due to increase the intracellular calcium by inhibiting the sodium potassium ATPase pump. So this increases the contractility of heart. So that's why there is a complete emptying of ventricles. Then increased the peripheral vascular. Okay. So there is an increase in the ventricular contraction and increased ventricular emptying, which is due to increased peripheral vascular resistance. So increase in the force of contraction without consuming the energy. यहाँ पे heart rate नहीं बढ़ाएगा, सिर्फ force of contraction बढ़ाएगा. So increase in the force of contraction without increasing the energy, known as a positive inotropic effect or cardiotonic. It is a cardiotonic. Now heart rate will be decreased. Heart rate will be decreased in the congestive cardiac failure. That is a negative chronotropic effect. So what is the refractory period? So dose dependent action is there on refractory. It will increase the refractive period at a atrioventricular node by its vagal action, and it will shorten the refractive period of ventricular मतलब एट्रियम जो है वहाँ पे वेंट्रिकल जो रिफ्रैक्टरी पीरियड है वो इंक्रीज कर देगा, वेंट्रिकल्स में रिफ्रैक्टिव पीरियड डिक्रीज कर देगा. कंडक्शन वेलोसिटी, so conduction velocity is increased at atria and decreased at ventricle. Then atomicity के ऊपर क्या एक्शन है? So increases the atomicity which leads to ventricular extrasystole even in ventricular fibrillation. So this that means यहाँ पे देखो ये क्या कर रहा है, atomicity increase कर रहा है. So this digoxin and cardiac glycoside increases the atomicity. That means they can produce arrhythmia. So increases the atomicity and which leads to ventricular extrasystole. Extrasystole means that is the arrhythmia, and even in the ventricular fibrillation. So arrhythmia is one of the adverse effect of your cardiac glycoside. Now blood pressure. So actually there is a little bit increase in the blood pressure. Increase in the blood pressure in the normal, but no increase in the blood pressure in the congestive cardiac failure patient. Now digitalis and calcium. Calcium ion increases the force of contraction. Digitalis also act with the synergistically. So calcium will act synergistically with the digitalis. ECG changes क्या है? Electrocardiogram changes. So changes in the T wave and ST segment. Changes in the P wave and PR interval. QT interval is shortened. ये छोड़ो, इसका कुछ याद नहीं रखो. और एक्स्ट्रा वेस्कुलर और एक्स्ट्रा कार्डियक एक्शन. तो किडनी के ऊपर क्या है? So it increases the diuresis in the congestive cardiac failure patient. That means decrease the volume of blood. So which is a desirable. Increases the force of contraction, which is also desirable. There is a decrease in the blood volume, which is desirable, and it also inhibit the renin release. It also deactivate the renin angiotensin aldosterone system. On the GIT, what is the action? It can produce anorexia, vomiting, nausea, diarrhea, and this digoxin can stimulate the chemoreceptor activation, can induce the vomiting. These are the extra cardiac effect. Cardiac effect में याद रखो, it increases the contractility by inhibiting the sodium potassium ATPase pump. It increases the intracellular calcium concentration and increases the force of contraction. इतना ही याद रखो. डिटेल में कोई नहीं पूछने वाला आपको. डिटेल में they are not going to ask you in the detail how drug act. They are not going to ask you in the detail. I'm just explaining you for your knowledge. Remember the pharmacological actions of digoxin on the heart. So it will increase the contractility, it will decrease the heart rate, it will increase the refractive period in the atria, decrease the refractive period in the ventricles, it will decrease the conduction velocity, it will increase the conduction velocity at atria, decrease the conduction velocity at the ventricles. Okay, due to vagal action. Vagal means it will stimulate the cholinergic vagal action. Automaticity, it will increase the automaticity, and that's why it can produce the arrhythmia. ये एक याद रखो. So these four actions you have to remember. They can ask you question on this. So digital is in the congestive cardiac failure does following things except. So it will increase the contractility, it will increase the heart rate, it will increase the respiratory period, it will increase the it will increase the automaticity, and answer will be it will not increase the heart rate, it will decrease the heart rate. कुछ ऐसा क्वेश्चन पूछ सकते हैं आपको. ठीक है. नाउ नेक्स्ट पॉइंट विल सी what absorption, distribution, metabolism, elimination, kinetics. So it is completely absorbed after oral administration. 90% of digoxin binds to plasma protein. It is metabolized in the liver. It will undergo enterohepatic circling and it has a cumulative effect. कार्डियक ग्लाइकोसाइड को क्यूमुलेटिव इफेक्ट होता है. मतलब क्या कि बहुत देर तक, मतलब क्यूमुलेटिव एज इट इज बाइंड टू प्लाज्मा प्रोटीन. तो ये प्लाज्मा प्रोटीन को बाउंड करता है 90%, तो स्लोली रिलीज होगा वहां से. तो अगर आपने डोज ज़्यादा दिया तो क्यूमुलेटिव इफेक्ट दिया तो ज़्यादा ये करेगा हार्ट के ऊपर. सो यहाँ पे क्या याद रखो, क्यूमुलेटिव इफेक्ट है, स्लोली रिलीज होता है ये. इसमें कॉन्सेंट्रेशन बढ़ जाता है बॉडी में, स्लोली रिलीज होता है क्योंकि ये आफ्टर एब्सॉर्प्शन बाउंड करता है प्लाज्मा प्रोटीन को और वहां से स्लोली रिलीज होता है. दैट इज अ क्यूमुलेटिव इफेक्ट. और एडवर्स रिएक्शन क्या है? फर्स्ट इज अ कार्डियक टॉक्सिसिटी. So it can disturb the impulse generation and impulse conduction. So as it can increase the automaticity, it can decrease the refractive period, etc. So it has a disturbance. It causes disturbance in the impulse formation and conduction, and that's why it can cause arrhythmia. Okay. So both due to formation of ectopic pacemaker, it can increase the activity of ectopic pacemaker. It can cause extrasystole and bigeminy followed by partial and complete EV block. They can cause EV, atrioventricular block, sinoatrial block. It can produce arrhythmia like paroxysmal atrial tachycardia and sinoatrial arrest. Okay. Remember hypokalemia. Hypokalemia means decreased concentration of potassium in the body. Hypokalemia from any cause will enhance the digoxin toxicity. अगर आपके बॉडी में पोटेशियम लेवल कम है, that can increase the toxicity of your digoxin. Remember the toxicity, cardiac toxicity क्या है? ये प्रोड्यूस करेगा arrhythmia. Then again, core pulmonary is again adverse effect. It increases the cardiac toxicity of diastasis. Diastasis can induce arrhythmia. On GIT, it will produce anorexia, nausea, vomiting. It also has a neurological toxicity. नर्व को भी डैमेज करेगा. वर्टिगो मतलब चक्राना, visual disturbances, burning, photophobia, disturbance in the color vision, tingling sensation, numbing in the lips, confusion, disorientation, delirium, and psychotic behavior. These are the adverse effects of diastasis. Digoxin or digoxin. Adverse reaction again. कोई miscellaneous adverse reaction क्या है? So this will cause gynecomastia. Gynecomastia means symptoms of ladies in the gents. Premature birth, ECG changes in the newborn. So it is a narrow therapeutic index drug. Remember, digital is a narrow therapeutic index drug. तो ये याद रखो, ये इसके ऊपर यहाँ पे क्वेश्चन आ सकता है. Digital toxicity is treated with the potassium. Digital toxicity is treated with the potassium. पोटेशियम दे दो, उसमें टॉक्सिसिटी डिजिटल का कम हो जाएगा. You have to administer the potassium. So digital toxicity is treated with the potassium, which is contraindicated in presence of AV block or renal insufficiency. Beta blockers are also used in case of supraventricular tachyarrhythmia in the complicated digital therapy. अगर digital therapy का complication है और arrhythmia produce कर रहा है तो beta blocker यूज करो. Ventricular tachycardia is treated with the lidocaine or phenytoin. Still, digital toxicity is not getting normal, then you have to use specific antidote for digital. इसके ऊपर भी क्वेश्चन आ चुके हैं. तो specific antidote for digital is nothing but the digibind or digipap or ovine digitoxin specific antibodies. ओके, ये याद रखो, इसके ऊपर क्वेश्चन आ चुका है. So specific antibody or specific antidotes for digitalis poisoning or digitalis overdose. That is a digibind, digipap or digibind, known as a digoxin specific antibodies. They are indicated in the severe digitalis toxicity, hypokalemia, and life-threatening condition. So they can save the patient. What is the uses of this digitalis or digoxin or digitoxin? So they are used in the heart failure, cardiac arrhythmia, congestive cardiac failure, left ventricular failure, atrial fibrillation, flutter, paroxysmal tachycardia. Digoxin is also useful in the chronic pure left ventricular failure. Acute left ventricular failure with pulmonary edema is treated with the intravenous furosemide. अगर pulmonary edema है तो digoxin भी दे दो और थोड़ा सा furosemide भी दे दो. Furosemide nitrates is inhibitor along with the morphine, sodium nitroprusside, aminophylline, and other inotropic drug like dopamine, and amrenon. Amrenon is a vasopeptidase inhibitor. Yeah, amrenon, milirinon. Renons are the vasopeptidase inhibitor. What are the usefulness of distalis? So distalis is very useful in case of this condition. कौन से? So it is very useful in the atrial fibrillation, rapid ventricular rate. Okay? Very useful. Now useful in the low output failure in the valvular hypertensive stomach and congenital heart disease. Digoxin is very limited use in case of high output failure, anemia, thyrotoxicosis, beriberi, and arteriovenous stenosis. मतलब ये acute heart failure में ज़्यादा useful है, chronic heart failure में है. It is not effective in case of mitral valve stenosis, constructive pericarditis, and restrictive cardiomyopathy. It is contraindicated. It is not used in the patient with AV block and hypertonic cardiomyopathy. Then what are the contraindications of this digitalis? Contraindications. तो hypokalemia. अगर आपको hypokalemia है, if your body potassium level is decreased, so in that case you don't have to use this digitalis. So increase in the digital toxicity is increased by hypokalemia. It is also contraindicated in digital is also contraindicated with the nidine and calcium channel blockers. It is also contraindicated in the myocardial infarction. Severe arrhythmia may develop. So this digital is used only after myocardial infarction. Heart failure is accompanied by alteration. It is also not used in the thyrotoxicosis, not used in the patient in the myxedema, ventricular tachycardia. Ideal management of congestive cardiac failure is done by major inotropic drug. So positive inotropic drug like dopamine, digoxin and digoxins are only inotropic drug available that can be given orally. डिजिटल इसका टैबलेट आता है, डिगोक्सिन का टैबलेट आता है, डिजिटोक्सिन का टैबलेट आता है, लेनोक्सिन नाम का एक टैबलेट आता है जीएसके फार्मास्यूटिकल्स में. So digoxin and digitoxin are only inotropic drug which are available that you can take orally. Adverse reaction important है. Now factors increasing the digitalis toxicity. कौन से factor digitalis toxicity का digitalis toxicity increase करते हैं? So first one is a metabolic factor. So hypokalemia, decreased potassium concentration in your body will increase the toxicity of digitalis. Hypomagnesemia, decreased magnesium level in the body will increase the toxicity of digitalis. Hypercalcemia, increased calcium level in the body will increase the toxicity of digitalis. There are certain drugs which also increases the toxicity of digitalis. These are nothing but the quinidine, thiazide diuretics, then verapamil and amiodarone. These drugs can also increase the toxicity of digitalis. Now, digital toxicity is also increased in presence of certain diseases. So, for example, partially we block hypothyroidism, myocarditis, then Wolff-Parkinson-White syndrome, thyrotoxicosis, renal failure. In case of renal failure, it is a contraindication for digoxin. Hepatic failure is a contraindication for digoxin. So these things they can increase the toxicity of disease. So there are different kind of heart failure. So first one is asymptomatic left ventricular dilation or mild heart failure of class 1. So these two are treated with the ACE inhibitors or angiotensin receptor blockers. Moderate heart failure or class 2 heart failure. So these are treated with the ACE inhibitors, beta blockers. Okay, or diuretics, beta blockers or ACE inhibitors. Moderate heart failure. In case of severe heart failure, class 3, so you use here digoxin, spironolactone, okay, digoxin and spironolactone. In case of refractory heart failure, okay, you use this digoxin, spironolactone, intravenous vasodilators and intravenous inotropic drug like dopamine. Then emergent heart failure means emergency in case of heart failure. So you use all the drugs. So safe drug in case of heart failure. One of the following category of drug is very safe in case of हार्ट फेलियर. तो यहाँ पे देखो सेफ्टी भी दिखाया. कौन सा ज़्यादा सेफ है? ये एंजियोटेंसिन कन्वर्टिंग एंजाइम और एंजियोटेंसिन रिसेप्टर ब्लॉकर्स. दे आर द फर्स्ट लाइन ड्रग यूज्ड इन द. उसके बाद में बीटा ब्लॉकर, उसके बाद में डायरेटिक, उसके बाद में डिगोक्सिन, उसके बाद में स्पाइरोलेक्ट्रोन. एंड अगेन लास्ट स्लाइड ऑफ टुडे सेशन. इट इज अगेन वेरी इंपॉर्टेंट स्लाइड. फार्माकोथेरेपी ऑफ डिफरेंट टाइप्स ऑफ शॉक. कितने टाइप के शॉक होते हैं, हमको कितने टाइप का शॉक लग सकता है. ब्रेकअप होने के बाद भी अलग तरीके का शॉक लगता है. टाइप्स ऑफ शॉक. तो फर्स्ट वन इज हाइपोवॉल्यूमिक शॉक. इट इज आल्सो नोन एज ओलियोजेमिक शॉक. ओलियोजेमिक शॉक और हाइपोवॉल्यूमिक शॉक क्वेश्चन एज इट इज आ चुका है GPAT 2019 में. व्हाट इज hypovolemic shock is also known as oligogenic shock and it is due to hypovolemic. hypo मतलब क्या, कम. वॉल्यूम मतलब क्या है, अमाउंट. किसका अमाउंट कम हो रहा है? आपके ब्लड का अमाउंट कम हो रहा है. Hypovolemic shock means there is a decrease in the amount of blood due to various reasons. So what are the reasons? Reasons are nothing but the due to acute loss of plasma. जैसे आपका ब्लड वेसल कट हो गया तो आपका ब्लड लॉस होगा. That is due to acute loss of blood or plasma in case of burns, in case of hemorrhage, in case of dehydration, in case of excessive vomiting, diarrhea, diabetic acidosis or Addison's disease. These are the reasons for hypovolemia. Hypovolemic shock मतलब क्या, क्यों हो रहा है hypovolemic shock? Due to acute loss of plasma or blood as in case of burns, hemorrhage, dehydration, due to excessive vomiting, diarrhea, and all that. Okay. So what is the treatment? You have to introduce the intravenous fluid. You have to correct the acidosis by using sodium bicarbonate. Treatment of underlying cause, like if diabetes is there, then control the diabetes. If any cut is there, then surgical intervention. And you have to use vasopressor like dopamine, noradrenaline, and morphine. Oxygen for hypoxia. So इसके ऊपर क्वेश्चन आ चुका है GPAT 2009 में. Excessive loss of plasma due to burns, hemorrhage, dehydration, vomiting will leads to one of the following. और उसके ऑप्शन थे hypovolemic shock, septic shock, ऐसा cardiogenic shock. So loss of blood plasma by any condition due to burns, due to excessive dehydration or excessive blood loss is known as a hypovolemic shock. Now, second type of shock is nothing but the septic shock or bacteremic shock or endotoxic shock. So obviously it is because of the infection. This kind of shock is due to severe infection of gram-negative bacteria like E. coli and some other gram-positive bacteria. Shock due to release of endotoxin. So what is the treatment? Dotracogene. Dotracogene is nothing but the first. Dotracogene alpha is nothing but the first activated DNA recombinant protein C used along with the standard therapy in case of severe sepsis at a higher risk of death. अगर बहुत ज़्यादा सेप्सिस हो गया तो उसमें डोट्रेकोजिन अल्फा ये क्या है? इट इज नथिंग बट द फर्स्ट एक्टिवेटेड रिकमेंडेड डीएनए प्रोटीन सी. सो दैट इज यूज्ड डोट्रेकोजिन अल्फा. रिमेंबर इसके ऊपर क्वेश्चन आ सकता है. Now standard treatment like using of appropriate antibiotics, correction of acidosis, increase the blood volume by your IV fluids and all that. Okay. Then hypertension, correction of hypertension, anti-endotoxin and monoclonal antibodies are also under the evaluation. That is the septic shock. Now third type of shock is nothing but the cardiogenic shock. Cardiogenic shock due to acute heart failure or myocardial infection or infection to the myocardium, that is myocarditis. Severe paroxysmal tachycardia that leads to cardiogenic shock. What is the treatment? Intravenous nitroglycerin relieve the pain by using morphine and vasodilators are used. Nitroglycerin next. Oxygen, antiplatelet drug, antiplatelet like aspirin, thrombolytics like your streptokinase, urokinase, etc. Maintenance of blood volume and vasoconstrictor drug like then positive inotropic drugs they are used. In case of cardiogenic shock, anticoagulant, beta blockers they are also used. These are the different types of shock. Again you can see pharmacotherapy of type different shock. Okay. Fourth type of shock is nothing but the anaphylactic shock. So it is due to the release of histamine due to antigen or allergic property, allergen or antigen. तो एनाफाइलेक्सिक रिएक्शन में क्या है? एंटीजन क्या करता है? मास सेल को जनरेट करता है एंड हिस्टामाइन रिलीज करता है. एंड बिकॉज ऑफ दैट you develop severe allergic reaction. So in that case you have to introduce IV fluid for correction of dehydration. Then drug of choice कौन सा है? In case of anaphylaxis, drug of choice is nothing but adrenaline. Adrenaline is the drug of choice in case of anaphylaxis. Glucocorticoids, antihistaminic, bronchodilators, and supportive major nursing care. That is the next type. 5 is nothing but the neurogenic shock. Neurogenic shock मतलब क्या? Shock encountered with the spinal anesthesia. If there is injury to spinal cord, if there is intense pain, okay, if there is a intense injury, testicular trauma, मतलब अगर आपको लेदर बॉल 2 टांगों के बीच में लग गया तो आपको ये ट्रॉमा हो जाएगा, टेस्टिकुलर ट्रॉमा. That can leads to neurogenic shock. Then so its treatment is similar to like that of hypovolemic shock. Then last kind of shock is a hemoobstructive shock. Hemoobstructive shock मतलब blood vessel का होना stenosis. Hemoobstructive shock, blood आपका obstruction हो गया, produced as a result of obstruction of main vascular channel. That is आपका main artery अगर obstruction हो गया, aorta हो गई, that leads to hemoobstructive shock. Shock due to massive pulmonary embolism. So it is again treated like a cardiogenic shock. So this was the today's session.